So I mostly grew up in the Twin Cities area. I then went to college at South Dakota State University. I did my medical school at the University of Minnesota in the Twin Cities. Then I went to do my pediatrics residency at Brown University in Providence, Rhode Island. And then my fellowship in pediatric GI was at the Medical College of Wisconsin in Milwaukee. I knew probably when I was in medical school and doing clinical rotations that I loved taking care of kids. And so I knew that I wanted to then do pediatrics. And then everything in GI I really enjoyed everything in GI. So it's the variety of the different things that I can do in GI, from seeing patients in clinic to doing procedures, and then also seeing patients in the hospital setting that have more acute problems. We really want to start with getting to know more about what brought the patient there to our clinic, so what sort of symptoms that they've been having. Really want to get to know the patient's story and find out all of those details to then be able to determine what is the best plan going forward, including like what tests we might want to do, and then what might be the most likely diagnosis to figure out what's the best plan. Probably the more common things that we see in our clinic would be constipation, stomach aches, diarrhea. We also see a lot of kids that may have feeding problems, or they may have a G-tube. We take care of kids that have inflammatory bowel disease, like Crohn's disease and ulcerative colitis, eosinophilic esophagitis. Those are all some common things that we will see in our clinic. My job is so rewarding. It's a privilege to be able to take care of these kids and be able to get to know their families and see them feel better and do better. Definitely love spending time with family and friends. Love to travel, enjoy watching movies and sports.